In some of these examples, we are not using an ultrasound probe cover, so it is easier to appreciate what we are doing. For the oblique approach, the vein and artery are pretty much in the same spot as they were for the short axis. You want to start by moving the ultrasound probe up and down to see exactly where is the vein and where is the artery. You can also perform a compression test to see if the vein compresses. On the right-hand side of the screen, you can see how the plane of the ultrasound beam cuts through both the vein and the artery. The ultrasound probe is looking and placed between the patient's chin and right shoulder in this case. You will know when you are in the wrong orientation when you slide the probe to the right and see the artery moving off the right side of the probe. In the proper orientation, if you slide to the right, the artery will move off to the left-hand side of the image. To begin the oblique technique, rotate the probe about 45 degrees clockwise since we want to see an in-plane view of the needle. This rotation will elongate the look of the vessels. Then, slide the probe laterally so the target vessels have moved to the left-hand side of the ultrasound image. Next, you will enter the needle posteriorly and shallow on the neck, aiming at the midline of the probe. Find your needle and then advance until you are in the vein. If you change the perspective and take a closer look, you can see how the needle comes in from the side instead of from the top. Looking from the side, you can see why we would want to be angled slightly above the artery when you insert the needle. It is safer to take a shallow approach with an anterior trajectory to stay above the artery.